Hello and welcome back to 360 Health. I am Joy Uchojim. We begin with news from the health sector. Now, President Bola Tinubu has called for a fairer global system regarding climate action, finance and healthcare, urging BRICS nations to lead efforts towards inclusive development and equity for emerging economies. Speaking at the 17th BRICS Summit in Rio de Janeiro, Brazil, Tinubu said Nigeria is taking bold steps to expand renewable energy, tackle environmental degradation, and achieve universal health coverage, while aligning with the global agenda for sustainable development. He further added that these efforts are part of Nigeria's commitment to sustainable development and global cooperation. And the United Nations Children's Fund, UNICEF Bauchi Field Office, has reiterated its commitment to fostering a culture of tree planting among the younger generation in the state. The chief of the UNICEF Bauchi Field Office, Nuzat Rafiq, made this known during a tree planting campaign held to commemorate the World Environment Day 2025 at the College of Education Technical DAS. Rafiq emphasized the importance of involving youth in environmental sustainability, noting that they are the leaders of tomorrow and need a safe and healthy planet to inherit. She added that UNICEF engages with young people through various initiatives, including WASH activities and climate change programs to promote environmental sustainability and a culture of tree planting among youth. And in other stories, the network of people living with HIV and AIDS in Nigeria, which is coordinating the implementation of the Global Fund's COVID-19 Response Mechanism grant, has called on all levels of government in Nasarawa State to provide the necessary support and cooperation to help combat illnesses such as HIV, tuberculosis, and malaria. The Nasarawa State Program Officer for the NEP1 C19RM project, Patient Sampson, made the appeal during a media roundtable held in Lafia, the state's capital. She explained that the project aims to strengthen health systems and improve responses to HIV, tuberculosis, and malaria through targeted interventions. The initiative is currently being implemented in 5 local government areas in Nasarawa State. A warehouse located in the Alagbere area of Lagos State has been sealed by the National Agency for Food and Drug Administration and Control (NAFDAC) following a targeted raid that uncovered expired chemicals, counterfeit packaging materials, and unregistered products being processed for distribution. While all operations have been suspended pending the outcome of an ongoing investigation, NAFDAC has summoned the warehouse's management to provide verifiable documentation regarding the origin and authenticity of the materials uncovered during the raid. Comfort Samuel has more details in this next report.
Acting on credible intelligence and multiple public reports, NAFDAC, in partnership with law enforcement agencies and other relevant stakeholders, carried out a targeted operation to dismantle a suspected unregistered warehouse at the center of a dangerous and illicit supply. The crackdown uncovered a disturbing stockpile of expired chemicals, unapproved pharmaceutical products, raising serious concerns about public health, regulatory enforcement, and the integrity of Nigeria's pharmaceutical supply chain.
This is one of the campaigns that the agency is doing to safeguard the health of Nigerians. We got information that some people are using the facade of doing business to do criminality, serious criminality that is going on here, and to also endanger the life of fellow citizens. We, as an agency set up by law to prevent such criminality, we've stepped into it to make sure that we bring whoever is committing it to justice. And what is it that he's doing? Simply, is to engage in sales of expired chemicals.
This is extract flavoring liquid. It's for food, flavor for food. They brought them and he's selling them. Everything is jammed together in this very particular place. Honestly, I don't know. Maybe when we see him, when we are interrogating him, he will be able to tell us exactly what was his agenda. What his plan is to murder as many people as possible, to kill as many Nigerians as possible, because anything you get from here, and he's selling them regularly. We've been able to get a lot of documents from him, a lot of documents, and the people that are also patronizing him. So this investigation have just started. We have not gone anywhere. We are going to get to the very root of everything that happened in this very particular place.
Several individuals linked to the illegal operation have been arrested and are currently in custody for further interrogation. NAFDAC has also issued a public warning about the dangers of unregulated products, urging consumers to remain vigilant, verify the authenticity of products, and report any suspicious activities to its nearest office.
Where you see something, say something. Like neighbors of this place now, no clandestine activity is going on there. Report. If you don't report, you also will be partaker of the evil act when the thing happens. If not you, your family or any other person can partake. So report to NAFDAC so that we can take action. That's what my message to Nigerians are.
If you have expired product, there is a way we handle expired product. We have guidelines online. They are all there in our website. We have all our regulations. They are also there in our website on what we do whenever something is expired. There are some that can be revalidated if they are not used for food, but we do not revalidate food grade chemicals, and we also do not revalidate pharma grade chemicals, that is pharmaceutical grade chemicals. We do not. And SCPN, we do not. And even SCPN, I don't issue permit. It's not just an ordinary raw material. There are a number of measures that you go through to get it. And nobody gave this man any recipient. How did he get it? He has a lot of questions to answer.
NAFDAC has vowed to intensify its enforcement efforts and strengthen collaboration with communities, stakeholders, and security agencies to eliminate the circulation of unsafe products and uphold the integrity of Nigeria's health and safety standards. Comfort Samuel, TV360 News, Lagos.
Now we'll go on a short break and return with the rest of the program. Welcome back. Nigeria continues to face significant challenges in maintaining a safe and adequate blood supply, despite the critical role blood plays in saving lives during emergencies, surgeries, and childbirth. The country requires an estimated 1.8 million units of blood annually, but only a fraction of this demand is currently met. According to the National Blood Service Commission, less than 10% of blood collected in Nigeria comes from voluntarily and non-remunerated donors, widely considered the safest source. Most donations come from family, replacement, or commercial donors, raising concerns about safety and reliability. The World Health Organization recommends a minimum of 10 units of blood per 1,000 people per year. But Nigeria falls far below that benchmark, relying heavily on family replacement donations rather than regular voluntary donors. Now let's get more insight into this situation. Medical Officer Gloria Lakpa joins me on the program. Thank you for coming on board. Now, what is the current state of blood supply in Nigeria, especially given the growing demand and the reported shortages?
Okay, so the current state of blood supply, or the supply of blood and blood products in Nigeria, is significantly short. So there is a scarcity, and then there is a very big demand for blood, which the supply cannot meet up the demand. So only about 25 to 50% of the demands for blood and blood products are being met. And then Nigeria, only has or can account for only 1.5 million units of blood annually. This is very far from the recommended WHO standard, where you should have 10 units per 1,000 population. So if you check our population and see how many units of blood we have annually in our blood banks, you see that there's a gap, a very huge gap.
Okay, so what do you identify as the biggest barriers to voluntary and unpaid blood donation in the country?
Okay, so the biggest barriers that I think, contributes to the poor voluntary donation of blood in Nigeria can be attributed to religious and cultural beliefs. Then there are some myths and misconceptions concerning blood, donation of blood, and then even transfusing blood as well. And so there are other barriers like logistic problems. So there's poor infrastructure. We don't have developed blood banks, and then most hospitals don't even have the equipment to properly screen the blood and blood products. So an enormous barrier will cut across religious, cultural, physical barriers like infrastructure, poor infrastructure, and all that. So basically, these are the major barriers influencing the shortage of blood supply or the shortage of blood donation.
Okay, so how safe and reliable is Nigeria's blood donation and transfusion system, particularly regarding the transfusion transmissible infections and screening?
Okay, so with regards to TTIs, that's transfusion transmissible infections from blood transfusion, most hospitals, like I said earlier, are not very equipped with the equipment to properly screen blood. So most of these, including the tertiary hospitals that have ELISAs and other equipment to help properly screen blood. So, and then the other, secondary and primary healthcare centers usually rely on rapid diagnostic tests, which are not specific. They are not highly specific, and then their sensitivity is not as good as using the ELISA machine and all that to screen blood. So there are still some, there are still some things that need to be done, to increase or to improve the safety of our blood and blood products. So there's still much work to be done.
Okay, so what myths or misconceptions commonly discourage Nigerians from donating blood?
Okay, so there are several of them cutting across cultural, family beliefs. Some people health-wise, they feel okay. So I'll just mention them in passing. So for some cultural beliefs, they feel it's only family members that are allowed to donate blood to each other. So you cannot take a blood from somebody else and give, which is just a myth. It's a misconception. It's not true. Another myth is if you donate blood, you can be at risk of sudden death, or you can get infected, or there may be infertility. I've heard different myths, but these are all myths. They are not real. They are not real because before you are even allowed to donate blood, you'll be properly screened against viral diseases, and then to be sure that you are fit enough to donate blood. So your blood level will be checked, what we call packed cell volume, to see if you are fit enough to give out your blood so that you don't collapse after donating blood. So there are so many steps taken to ensure that you are safe to donate blood and you will be safe after you donate blood. So those myths and misconceptions are not real, and then they don't exist in any way.
Okay, thank you for that explanation. Now, from a medical standpoint, how often can a healthy individual safely donate whole blood without affecting their own health in that case?
Okay, so a healthy individual, for females, is recommended 3 to 4 months. So maybe quarterly or, every 4 months you can donate blood as a female. For men, up to 8 weeks, WHO recommended standard, up to 8 weeks, men can donate blood. That's 2 months. But to be on the safe side, on the average, quarterly. Quarterly, it's safe to donate blood quarterly. And this is because this is done in response to the body's way of replenishing the blood that you've lost. So within 3 months, red cells are already matured, they produce blood and all that. So within 3 months, you are able to get fresh blood and all. So it's just for your body to be able to, compensate for the loss of, the donation that you did. So that's it.
And why is it particularly important to encourage young and regular donors? And what impacts do they have on blood supply, especially in Nigeria?
Okay, so young people are important in the supply chain because for continuity of the supply chain, if a young person starts donating early, he has a longer time to keep donating. And most times, the elderly from 65 above are usually not advised to donate because of other comorbidities that must have been happening, or other, disease of the aging and all that will be taking place at that time, so that you don't further tip them into morbidity, that's into, being ill. So it is important that young people, the strength is still there, the will to do that, and then the consistency. We have a longer period to donate blood. So it's very important for young people to come together and save lives through blood donation.
Okay, do you observe seasonal trends or emergency situations of such as holidays or disease outbreaks that affect blood demand and availability in the health sector, especially in Nigeria?
Yes. There are many situations that could occur that may significantly impact on the demand or the supply of blood. So for the demand of blood, once it gets, too much, usually during festive seasons, sometimes during a pandemic, and then some other times, maybe a mass casualty situation, something happened, and then many people need blood at the same time, maybe a bomb blast or a road traffic accident claiming a lot of people more than the facility can handle, then they start, demanding that the blood bank in the facility may not be able to handle the situation at the moment. So they have to call for help and all that. So at that kind of time, we usually see it once in a while where the demand is outrageously more than the supply.
Okay, so for the viewers who are watching this program, how can everyday citizens contribute to saving lives through blood donation, even if they are unable to donate themselves?
So for people, to support the campaign on blood donation, you necessarily don't need to even donate blood yourself. If you're not fit to donate blood, you can help by providing resources, logistics, even providing support groups, advocacy groups to drive policies to improve on our blood banks in Nigeria, and then blood policies in Nigeria and all that. So many things can be done through advocacy, through support groups, and then voluntary donations to help boost blood drive. So also you can partner with NGOs that are into blood drive. So there are so many individuals and NGOs going into personal projects to increase awareness on blood donation and all that. So we can partner with them, support them with giving resources, logistics, and all that.
All right, lastly, before I let you go, in light of the current low blood donation rates in Nigeria, what is your message to Nigerians about the critical importance of donating blood?
Okay, thank you. So dear Nigerians, dear Nigerian youths, please go out there, support blood donation, be a blood donor. If you can't be a blood donor, please save lives by supporting blood donation through your advocacy, raise awareness campaigns, and then talk about the myths and misconceptions of blood donation, educate people against such myths and misconceptions. This will help to improve, emergency response, and then to decrease the number of mortalities we have in our hospitals. So it's very important that we improve blood drive, freely donate blood, and then also support blood donation. Thank you.
Thank you very much for your insights, Medical Officer Dr. Gloria Alakwa. Thank you very much for coming on the program. Well, that's it on this episode of the program. Many thanks for joining us. See you next time.